Hi, Paul Sackis, Good News Broadcast, speaking to Jeffrey Weinberg, who's an MD. Hi, Doctor. How are you?
Hi, how are you today?
Okay, good. Assistant Clinical Professor of Dermatology at Columbia University College of Physicians and Surgeons in New York City. And you're also a Director of Clinical Research Center of, oh boy, what kind of word is this? Dermatopharmacology? Help me out here, Doc.
I think it's don't worry about it, but dermatopharmacology.
Well, at St. Luke's. Okay.
Skin medicine, in other words.
Skin medicine, all right, and that's my hospital, St. Luke's. The sun is not seasonal, and today's actually the ending of summer, but the sun is still shining, thank God, and it's never too late to protect your skin. Okay, so what are some thoughts here?
Well, generally what we tell people to do is to protect their skin every day with sunscreen, usually about an SPF 30 or above. And there are several good products that are out there. It's important, especially when you're in the sun, reapply if you sweat. If it's during the summer, wear protective clothing, wear a hat, avoid the sun in its strongest hours. But, if people are generally pretty good about that, it'll help a lot.
Okay. There's something here that says many people that, because cancer is skin cancer has increased significantly over the years, isn't that so?
Yes, I mean, certainly we're seeing more skin cancer. We're also seeing a lot more melanoma. And the reason why we're seeing melanoma, people really aren't clear on the exact reason why. Is it that it's increasing, or is it increased detection? But certainly we know that with the ones that are generally caused by sun, such as squamous cell carcinoma and basal cell carcinoma, that we're seeing more of those.
Okay, so when somebody, it's recommended, right, for people to go see a dermatologist yearly to be checked to see if there's any growths on your body. Is that right?
Yes. Generally what we're telling people is once a year, come in, get a full body exam. But the other thing we tell people is check your own body once a month. That's just as valuable, so you have an idea, because people, obviously live with themselves every day, and they're going to pick up changes before we will.
And the sooner you detect something, the sooner you get to a dermatologist, the potential of them dealing with it, are taking, literally cutting it out, or putting something on it? What are some ways that then they will deal with it?
Well, when you think about the more common ones, the basal cell and then the squamous cell, and there's also the precancerous ones, the actinic keratoses, it depends. There are several different ways. I would say that once it's a cancer, the most common way is either to cut it out or to scrape it out. There are, for certain cancers and in certain situations, there are certain creams that we can use.
Okay, and what would be a cream that can be considered?
Some of the creams that are out there that are indicated for precancerous lesions include types of 5-fluorouracil, which is like a topical form of chemotherapy. There's one in particular I use called Carac. It's used once a day for 1 to 4 weeks. As I said, it's indicated for precancers, but sometimes you can also use it in situations where you don't want to do surgery. Another one's called Aldara. This is a medication which was initially approved to treat genital warts, but it also is approved for precancers and certain types of skin cancers. Okay,
so I burnt myself badly when I was a young guy up in Jones Beach with baby oil. And I would keep going back and thinking that, being tan was a good thing. And my forehead is very sensitive. Where you have sensitive areas, just put more sunscreen on, or you almost sunblock?
Well, again, if you're going to find that there's a certain area that can tend to get burned more than others, then yes, you can use a physical block such as titanium or zinc dioxide, which just give you a little bit more protection. You can use a hat. You can reapply more often. For people who are really concerned where there's a real issue, they actually sell sun protective clothing. There are official places where you can go and buy things that with the clothes really block out all or most of the ultraviolet rays. So there are a lot of options.
Okay. There's AK. What is this?
AK, or actinic keratosis, is a form of precancer probably one of the most common reasons why people come to a dermatologist. What you find on the skin are small little white scaly lesions, usually on the base of the lesion's a little bit red, and in some cases, some of these can go on to form skin cancers.
Okay, so then, and who's at risk?
Anybody who has light skin and who's had a lot of sun exposure.
Okay, and it appears wherever the sun is hitting it, or what?
Generally, we see them mostly on the face, the ears, the back of the hands and arms, but some people who have more sun, I can see it on the body as well as on the legs.
And so that also can lead to more concerning parts of cancer?
I mean, if they progress, the number that I was taught was 1 out of 20 to 1 out of 50, but some people estimate it may even be higher than that. And when you find some skin cancers, very often they're found in association with these, like growing out of actinic keratoses. So, they're not. It's more of a chronic problem, and if people are followed chronically and either treated with some of the topical medications we talked about, or with freezing them off, generally you can keep on top of them. But a lot of people grow these, because they just had a lot of chronic sun.
Yeah, some people do this. It's probably not the politest thing, and hopefully you're doing it within your own home. But people pick on their skin, right? I mean, it's something, I know people that, have pimples, they pop them, and, and I imagine, is that wise or is that unwise? I mean...
It's unwise, not because there's any risk of skin cancer per se, more because they can scar their skin. I mean, if people have a bug bite or a pimple that would have healed normally and they pick at it, they can actually leave marks and then scars. So nothing good can come out of it, let's put it that way.
Okay, so now let's think about our bodies now. So what are some kinds of things that we should be looking for on our bodies?
Well, generally, again, if you're thinking about it in the realm of skin cancer, when you think about melanoma, which is, potentially deadly, you want to look for any brown spot with regular shape, size, or color, irregular pigmentation, something that's changed. And I would urge everybody to go. Actually, you can go to the American Academy of Dermatology website at www.aad.org, and there are many good illustrations there of potential skin cancer. And melanoma, you want to catch early because, as I said, this can be fatal if not caught in time. Other things, the basal cell, the squamous cell, the actinic keratosis, again, these are less threatening in terms of mortality, but you still want to obviously get them as soon as you can. But you want to look for any a bump that's bleeding and not healing, just not going away. That's either the shiny that's again, just in a place where there is sun exposure, and it just doesn't look like everything else. That certainly would be something to look at. Okay.
All right. Very good. Are there any other websites we should look at?
As I said, AAD.org. There's a website, the CARAC website, carac.info, is also useful to talk about a lot about the precancers. And I guess that would be...
What's this, WeHealNY.org? That's one also?
WeHeal.org is the Beth Israel website for my hospital.
Oh, okay.
But I would say for skin care in general, either the AAD.org or CARAC.info.
Okay, perfect. Okay, Dr. Weinberg, thank you very much.
Thank you.
Bye-bye.
Bye. Have a good day.
You too.